Mount Sinai is a special place. All of our team members are uniformly committed to our vision of taking care of children and providing cutting-edge care in a compassionate manner and embracing the family in a family-centered approach.
Everybody from the social workers to the nurses to the x-ray technicians couldn't have been more accommodating, reassuring, and positive that ultimately everything would be okay.
I have the utmost confidence in this team. There's no doubt that they have the credentials, that they have the experience. Most importantly, they have the love and they have the passion for our children. They are a unique gift from above.
They're very invested in how she's doing, not just her heart, but how she's doing in school and how she's growing, and they do that with every child that's here.
Everything here is just better.
When our son Thomas was born, and I heard a nurse say, "Has anyone listened to this baby's heart?" Everything stopped, and we knew that time was of the essence. So my husband drafted an email, and it went something along the lines of, "To whom this may concern, we believe you to be among the best in pulmonary valve stenosis. Attached, you'll find our American Express card number, our medical healthcare number, and charge us whatever you feel is reasonable. But tomorrow you're going to receive a VHS tape of our son's heart. Please, we're begging you for a second opinion." Phone rang at 7 o'clock at night, and it was Dr. Ira Parnes. And he referred to himself as, "Hi, Allison, my name is Ira. I received your email." And right there and then I knew that this man was extremely special. After 45 minutes of talking with him on the telephone, I asked a simple question: "How do I get to see you?" And he said to me, "How fast can you get to New York?" And that next morning, he met us here at 7 o'clock in the morning, and really the story goes down in the history books as one that was a great success. As Dr. Parnes likes to say, don't even tell anyone that he has a heart condition, Allison. It's as close to perfect as it's ever gonna get. And in my eyes, my son is perfect thanks to this team of doctors.
Taking care of children with heart defects and heart disease is a team sport. There's no question that the more tightly integrated we are as pediatric cardiologists with the other departments and divisions that provide care to our children, the better the outcome is. We have the best team anywhere. We're so proud of the people that we have, not only because of their expertise, but more than that, we have compassionate people, people who are committed to taking care of children in a compassionate manner and who are understanding of the importance of embracing the entire family and making them comfortable with what is a very stressful and uncomfortable situation.
Being told that your child has a potentially life-threatening cardiac disorder can be absolutely devastating. Support for the child is obviously priority, but the family unit again has to be maintained because the child will be going home eventually. We have a child life service here, which provides family-based care within the hospital and support for parents and caregivers while the child's in the hospital environment, which is then continued via our excellent social work department through to when the child goes home.
Grace had a disease called severe combined immune deficiency, where you're born with no immune system. So when she was 7 months, she got very sick and just was not getting better. And we were overwhelmed and terrified. We had oxygen and pulse oximeters at home, and she was on 20 different medications. And I kept saying to my pediatrician, how can a child live like this? This doesn't work. And he said, no, it doesn't. Sometimes you have to find someone new and something different.
Dr. Parnes, I mean, the first thing you realize when you meet him is that he loves every child he treats, and he treats them as if they are his own kids.
He's just not only the nicest man, but the most intelligent, caring doctor I think that we met. We've met a lot of them.
He'll say hi to me, and he'll ask me, like, did you have fun in school today? What did you do?
It is so far ahead of its peers, I think, in the state of the art of treating patients, treating their families, helping with what I think is a really important part of treating children with lifelong illnesses, which is alleviating unnecessary stresses.
Here's the fortunate position that I'm in. We almost always beat the disease. We have incredible non-invasive tools to figure out the diagnosis exactly. We have incredible surgeons and interventional cardiologists who can fix almost anything. For nearly all patients, we're going to get them through even the most complex of heart surgeries, and we're going to see their children grow up into healthy, active, productive children who do what kids do: get into trouble, go to school, play, and make their parents worry.
I had open heart surgery when I was a baby, and my friends were surprised when I told them, because there's nothing different about me, and I can swim and play softball without taking a rest or anything like that.
I actually delivered at Mount Sinai, so thankfully we were in the right place at the right time. She's born, and in less than 24 hours they tell you that she has this congenital heart defect and needs open heart surgery. And they talk about how serious it is, and then in the next breath they say, but don't worry, it's really just a little plumbing problem, we'll fix it, she's gonna be fine. So while we were quite aware of the serious nature of her problem, they made us feel very comfortable.
It's the people across the board. I mean, it's the physicians, it was the nurses, it was anyone we saw here. It's the way they are, the way they embraced us from day one. I've never been involved from the beginning with any sort of healthcare experience, at least in my life, where you've had the feeling that they are in this with you.
They never have made us feel anything but the most important person. It's a friendship, it's a partnership, it's a love affair with one another.
The work that's done here is pretty amazing. I've worked in about 5 intensive care units, and the quality of the work that's done here is by far superior to anything I've ever seen.
You know, every year we have a Valentine's Day reunion party for all the patients who've undergone surgical procedures and catheterization procedures. When the physicians see their patients outside of the environment of the office, they light up. This is our reward when we see them healthy and enjoying themselves and being children. It's a very tight bond that we have with families. And when you take somebody through something life-threatening, and you're with them the whole way through complications that need to be managed, you don't shy away, you're partnering with them, then when you emerge, you're lifelong friends.
If I could, I would empty my bank accounts and I would give them every single penny that I possibly have to help continue the profound work that they're doing in this department, because I know that there are other children out there just like Thomas, and they deserve to get the same exact treatment that Thomas did.
When we walked away from the experience, 6+ months afterward, you said to yourself, we've got to give something back to this group of people. We've got to be able to, perpetuate this outstanding care, because it's a really special place. It's the personal commitment they make to every one of their patients.
Look at all the people in pediatric cardiology, just the way they changed our lives is, you can't express it.